Over the years, I have been very cognizant of the fact that it's very difficult to consistently radiograph the equine foot in such a fashion that I could get repeated views of high quality with great certainty day in and day out. There are many, many variables involved from the time you take your x-ray machine out of your truck until that film is pulled out of that processor to be reviewed. The variables can either make you or break you. Without identifying all these variables, you don't have a clue as to why one time they're good, one time they're bad. I think all of us as equine practitioners have experienced the feeling as we reach for a film to take them out of the processor, whether it be a dip tank or an automatic tank, and have the feeling, surprise, surprise, I wonder what we're going to get this time. To drive several miles or several hundred miles to radiograph a horse's foot, to return to your office to develop them hours or days later, and to suddenly find that your positioning, your technique, something was not up to par, and your film are deplorably impossible, total waste of effort for you and your client. You're left with one or two things to do. Repeat everything and end up taking the same risk as you did before, calling the client and saying, I'm sorry, the developer ate the film, we've got to take them over. Or, I'm sorry, the film were dropped in water and they ruined. They stuck together, they're in the mail, whatever the excuse may be. Many times you never return to take adequate film because of the economics involved in the strategic location of that animal. Those of you that must take all your film in the field are handicapped tremendously by the environment. This is one of the largest variables you've got to reckon with. You need to have the horse in a safe, dry, clean, preferably warm in the winter and cool in the summer areas to work. Away from flies, away from noise, away from alligators and anything else that may interrupt your concentration of that of the horse. Believe me, I've been there. I watch you all in this position regularly trying to take high-quality radiographs as the horse goes by, as the hay man is blowing his horn, waiting for you to get out of the way, as the inexperienced groom is jerking, snatching, running the horse over your equipment. It's impossible. You can't work under these type of handicapped conditions and do consistent, high-quality work. I'm going to describe a very explicit, detailed manner so that with great certainty, before you push the trigger on your x-ray machine, you know what that film will look like when you pull it out of the processor each and every time. That's a good feeling. I'm also showing you a way that you can learn your anatomy. If you do not see consistent views, positioning views of the equine foot, you never have the opportunity to learn normal anatomy from pathological disease processes. If you're not disciplined in your positioning to where you have consistent position, you see a different anatomical projection of that foot each and every time. Therefore, many of the problems that are called pathological is nothing more than normal anatomy. It was not until I increased the quality of my film and the consistency of my positioning did I realize that I probably had misdiagnosed 90% of the feet I'd looked at. I was calling things pathological only because I'd never seen them before. I happened to have a new projection. You're doing the same thing unknowingly. Many times the response to your therapy is varied because you have missed a diagnosis. You've missed a diagnosis because you've misread the film, and you've misread the film because you're seeing anatomy you have never seen before. On the contrary, this anatomy could be pathological, and if you have not seen the normal, then it's very difficult to identify the abnormal. So let's start from gram one. Let's be very disciplined in our thinking process inner technique, and develop a protocol that meets the needs of today, that meets the equipment that you use, accessibility to update equipment. It's been notorious for veterinarians over the years past to buy used equipment from the human field. You can buy used cassettes for $25, $30, $50, $100. You can even get lucky occasionally and someone will give you a couple dozen cassettes. Believe me, if that's the case, they did not give you much. Human doctors will not give away anything any quicker than you will. And if someone gives you a stack of cassettes, you better believe that's exactly what they're worth, nothing. Don't try to adapt your procedures and technique to outdated, antiquated, obsolete, wore-out equipment. Investment in good quality equipment is probably the first step in taking good quality radiographs. The portable machines, there are many companies on the market today that have developed a machine that is light in weight, has variable MA, which I feel is important, has a KV of less than 100, between 70 and 100, has a timer that will go down to hundredths of a second. You can get them with light collimators. Most of them are very durable. They can be operated on 110 or 220 current. And they're in a marketable area of 5,000 or less. Then you can get into the larger portable machines that go up to 100 kV, which have some advantage, but you must weigh that advantage against the fact that they're twice as heavy. Some of them as much as 3 times as heavy. They're quite larger, they're harder to transport. Positioning, handling, so forth becomes a bit of a problem. So you must weigh the advantages against the disadvantages when looking at the larger machines. The point I wish to make is good quality, variable speed, variable MA setting portable machines will take immaculate views of the equine foot provided you have proper line voltage. You do not need a large 500 or 1000 MA machine to take superior, consistent, better than adequate views of the equine foot. Your screen and film combination is very important as well. You must have high detail, which means slow speed, and you must have fast speed in order to accommodate the use of taking a picture on it with a horse. Anything less than 1/4 of a second is considered adequate time. Anything over 1/4 of a second, you must be careful of movement. High-speed systems have very little detail. They're very grainy. You can take them at 1/10 of a second or less, but you have very little detail. Resolution is very important. You can work with your local DuPont or Kodak representative, and they will explain to you the advantages and disadvantages of high resolution, low resolution, what they can offer you. I have helped develop basically 2 standardized systems that are now used widely around the equine industry. Kodak has a system called LANX system. The LANX medium speed screens offer the equine practitioner the ultimate in detail for portable machines and a time factor that allows you to minimize movement. The LANX medium has better resolution and better detail than does the LANX regular. And the regular is better yet than the LANX fast. The DuPont system is called the equine system. I developed this system several years ago, trying to increase my ability for detail. Using a detail screen in front and a fast screen behind gives me, at this time, the best of both worlds. I have maximum detail, and I can cut the speed back to where it is feasible to use it with horses. So I'm staying around 1/4 speed, maybe occasional 0.32 as my maximum time of exposure. Using either one of these systems and consistent technique, you're able now to go to the darkroom and emerge with film that are of highest of quality. The darkroom also is a place that variables will kill you if you're not real careful. You must have a clean environment. You do not want dust in your screens. Do not open your cassettes open wide so that the dust that is settling out of the air, that's been put in the air because you slammed the door, it goes into your screens. Open your cassette on the side, pull the film out, close them, put it in the processor. If you're hand dipping, it's the same technique is used. Do not open your cassettes wide open in the room. Your developer and your fixture must be fresh. You must also remember that temperature on the automatic processors is very, very important. Extreme variables in temperature change your detail and your processing tremendously. Whatever temperature you elect to choose, and I am using a 96-degree temperature, you must stay within 1 degree of that at all time. Otherwise, your detail changes. That's why when you take pictures or radiographs in the field and you go to another processor for development, you may be underexposed or overexposed. This is basically due to the temperature of the developing solution. Let's consider all factors normal and consistent with machine, film and screen, and developing process. Now let's go to the foot. I wish to prepare the foot so that I have no debris on the underside of the foot, on the outer side of the foot, on the bulbs of the heel, or on the hair immediately above the foot. I want to clean this with a hoof knife, screwdriver along the sulcus of the frog, a rasp along the bulbs of the heel to remove any debris, sponge and water to remove dust, mud, debris that's left on the outside of the wall and on the hair. Dry the foot, removing all moisture. Do not leave water dripping on the heels because you will be able to see this radiographically. Set the foot in a dry, clean area, not back on a dirty floor. You do not want to see any debris whatsoever on your radiograph. You're looking for pathology, not for debris. Invariably, if you do not clean the foot up in this fashion, that debris will be superimposed over an area that will be questionable. It's questionable because you cannot identify normal anatomical structures. Once the foot is cleaned up, I want to sedate the horse. I sedate almost 100% of my radiographic patients. We give approximately 0.2 of a cc to a mature horse of domocetin to basically every equine patient radiograph. I do not want to be disturbed by the horse who is startled by my movements, by my positioning device, by whatever. I want him to stand quietly. I want him to be very still. I want him to be attentive. I don't want him to be loose-legged and wobbly drunk. I want the holder to be alert to what I'm doing and understanding what I'm going to do before I start. And once I start taking my radiographs, I'm going to take 10 to 15 views in less than 2 minutes. I want all systems to go before I start taking radiographs. Then when I'm finished, I spent little time actually with the technique of taking the radiographs. My time is being given to preparing the foot, preparing the patient for proper pictures. I'm now using a device that I designed several years ago that has been on the market off and on for a few years. It's been very difficult to manufacture this positioning device on an economical level due to the handwork that has to go in it. But this particular device allows me two positions, a 65 and a 70-degree angle. That's an angle off the ground surface of the foot to the ground. It allows me a constant fixed distance from beam, from focal point to subject to film. It allows me a consistent way to know exactly the position the foot is in relationship to that beam. It also allows me to set the foot in a position that allows me to take all my views, my standard views, as quickly as the operator can set the cassette into the device. Most horses accept this device very easily. It's such a quick, easy way to get around the horse. It allows me to put the handler in an area that is going to be out of direct line of radiation. My assistant does not have to hold the cassette, which removes him from the hazard of radiation. Myself, my assistant, and the handler will wear a lead apron. The assistant will wear a lead glove. No one will be standing in a direct beam. Anyone in the room that is not taking radiographs or concerned with the procedure must stand at least 12 feet from behind and from the machine. It's quite easy for us to overcome the hazards of radiation if we just adhere to the safety standards that are being given today. Using this device, I will take all the standard views except the lateral and the straight-on AP. I will now use the wooden block, which is 3 inches deep, 5 inches wide, 7 inches long, with a wire embedded in the top, to take my standard lateral. This will put the primary beam of my machine, which is about 4 to 4.5 inches from the ground surface, just at the very bottom of the coffin bone. This way I get a true lateral each and every time. You must line the machine front to back, top to bottom, be in the same plane, and you will get a consistent true lateral each and every time. Then the block is turned crossways, so the wire is now transverse to the axis of the horse. I shoot my straight AP, looking for medial lateral imbalance in relationship to the ground. Side bones and other problems can be diagnosed this way as well. The technique I'm describing here is a very detailed, consistent way that you can take radiographs each and every time in any condition and be consistent.